show you kind of just pulling itself. You have to look at the resting position of the hip, okay, is 30 degrees flexion, 30 degrees 30 degrees abduction, and slight external rotation, okay? When you are mobilizing the hip, you need to ensure that the person does not have any knee issues, because you are going to be using the long lever arm of the leg to provide the traction force. So you are going to traction through somebody's knee. So just clear that out, okay? Make sure they don't have any issues of their knee. And all I'm going to do is I'm going to do what's called a joint traction, but essentially it's a long axis distraction, okay? And if I'm pulling towards me, what could you also call this? Inferior glide, okay? So what I'm going to do is I'm going to put her in 30 degrees of flexion, 30 degrees of abduction, slight external rotation. I'm going to stabilize above her ankle, okay? And then I'm just going to pull towards me. And if you look, I'm just leaning back. And Jillian's, and then
I love the pink.
All right, so basically you're going to make a figure 8, okay? They do have mobilizing belts that work better with this, okay? But we don't have that, so we'll make shifting it with gate belts, okay? I'm going to come down underneath here, okay? Then I put the belt right on the axis here. Now, you want to get the belt behind you right on your derriere, because it's a big part of your body, correct? And as I pull back, I basically stick out my bum and create that traction force. And for her, it's almost too much, okay, because she's not that big. Okay, when we're dealing with the tibial-femoral joint, we have a fixed femoral condyles, okay, which are what? Convex. And we have a mobile tibia, or tibial plateaus, which are what? Concave. So your convex-concave rule is what? Same. Yes, the slide is going in the same direction as the bone, okay? First, though, we're going to show you distraction, okay? Because the treatment plane falls in the mobile segment. As I move her tibia, okay, that treatment plane changes. So my line of pull is going to change. So when I do traction in the resting position, which is 25 degrees of flexion, okay, my treatment plane falls within those tibial condyles, plateaus, sorry, and I'm going to pull right along the shaft of her tibia. Okay, that's going to change once I kind of get her more motion, and if I need to do distraction down at 90 degrees, okay, again, my line of force goes right along the shaft of her tibia, right through that concavity, and it's going to be pulling straight down towards the floor. Okay, so I'll show you a couple different ways to do this. I use a towel or cuff oftentimes for this, and I'll show you that, just to get some leverage. Okay, so I will wrap the towel around her ankle. I will get her into 25 degrees for you guys, okay, of flexion. I am going to use my mobilizing hand, okay, and I'm going to provide my force in that direction. Okay, I use my other leg just to kind of not stabilize, but keep her in that 25 degrees or whatever degree of motion I want her to have. Okay, so I don't leave her hanging in the wind here. Okay, so I just rest her leg against my thigh, and then I come straight down. Now, if I'm really good, okay, I can slide a finger right into the joint line and feel the traction. And you probably feel that. And I feel the traction as I'm doing it. Okay, she's pretty easy, she's small, so I can do it one-handed, and it really gets me a good sense of how much traction or distraction I'm getting. And my mobilizing hand is this. Okay, so everything's, I can go, look, Mom, one hand. Okay, good. If I move her down to 90, okay, all I'm going going to do here, if I had a high-low table, it would be nicer, but I'm bending my knees, okay, and I'm coming straight down to the floor. Same thing. You can even see it. Can you guys see that? Same thing. I get my hand, finger, and joint line and provide the traction. The traction force is going straight down to the floor at 90. And that's how you do traction. And you do it any angle in between. I'm going to show a posterior glide. If I do a posterior glide, what motion am I trying to correct? Flexion. Okay?
Why is that?
Slide, or the glide, and the direction of the bone go in the same direction. Okay? Because the treatment plane is in the concave surface. So, again, I bring her to 25 degrees. Okay? I will get right slightly below her tibial tubercle, because if I get on it, sometimes that can be painful. Okay, so I go slightly below it. If I can, I sneak a pinky right up into joint line. Okay, and then what I do is I don't even need to, in this position, provide any type of distraction, because if you look at how gravity's taking her, or taking her lower extremity, what's it doing? It's doing a slight traction. Okay, so I come, my mobilizing arm is straight, and my force is right down here at this angle. Okay, and I do a posterior glide.
That's 25 degrees.
25 degrees of flexion. Now, obviously, if I'm going after flexion, let's hope she doesn't have a restriction at 25. That means she doesn't have much motion at all. I can bring her down further. Let's say her restriction is down here at 40 degrees, okay, and then mobilize her down there. Posterior. Anterior glide, okay, which is to increase what motion? Extension. You're going to place them so that their leg right above their kneecap, okay, their kneecap is not on the plinth, okay, their upper thigh is, okay, that's where you're positioning them. If you have to, you can put a towel, okay, underneath here to kind of make it a little bit more comfortable for her as well, okay? What you're going to do here, okay, is, again, put her in, for the class purposes, put her in 25 degrees of flexion, because that is the resting position. The key to this mode, okay, is that you get through her gastroc soleus. A lot of you guys will be doing this, and you'll forget about this nice big muscle here, and you'll do this, and be like, wow, I really feel that, and wow, there's a lot of motion. All you're doing is giving her a nice little massage, okay, to her gastroc soleus. So I kind of massage my way through to the end, okay, get through that muscle bulk, okay, get close to joint line, and then my line of force is along this angle, okay, it's following that treatment plane. My elbow is straight again. If I can sneak my pinky into joint line, that's great, and I provide an anterior force, and that's an anterior glide for increasing extension.